Welcome to your Barbados Today Evening News Update for Thursday, January 14. So glad you could join us. Our top story. Prime Minister Mottley and 7 others have received Barbados' first COVID-19 vaccines. She made the disclosure at this evening's COVID-19 briefing at Elara Court. She assured that every effort is being made to secure more doses for the wider population.
There were 5 of our medical people at the front line who have taken the vaccination, the first dose, and myself, the Minister of Health, and the Attorney General also were the other 3 people who took it. My arm is a little sore, but other than that, I'm in good shape. You see me talking with you, and I am due to take the second dose in a few weeks' time, as are they. At the same time, Minister Walcott has been working feverishly for me to be able to access the other vaccinations. I think we've had meetings every day this week with different suppliers or different groups.
Meanwhile, government reported that it's making headway in easing the backlog of COVID-19 test results, having put the new categorization system to work. Prime Minister Mottley estimates the backlog should be under control by this weekend.
Last week, taken 2,000, 2,500 a day. On the 7th of January, we received 2,154 tests, and we have already completed 1,717 results for that day. For the 8th of January, we received 2,786 tests, and we have already completed 1,278 in that backlog. On the 9th of January, we received 1,384 tests, and we've completed only 414, and on the 10th of January, 1,165 tests were received, and we have completed 213. If you can see by the numbers of tests, you will begin to understand, therefore, that what this country faced last week was a veritable explosion between the 31st of December and the 10th of January, not even the 10th so much, more the 9th of January, a veritable explosion in the numbers of tests that even with the best will in the world would have placed strain on any system. It was an operational failure, not because we don't have a number of machines, but because we did not have the capacity to deal with that large numbers of tests within the short period of time, especially over the holiday period.
There were 29 new positive coronavirus cases today. Health Minister Lieutenant Colonel Jeffrey Bostick revealed the latest numbers during the briefing.
Out of 1,429 tests that were processed by the lab, that there are now 29 new positives, 29 comprising 21 males and 8 females. 12 of those positives are from Her Majesty's Prison Dodge, including 1 female staff member, 4 males, and 7 male inmates. 3 of the new cases are persons who would have been sent to Harrison Point Isolation Facility for assessment, and they have been confirmed as positive. And let me say that 28 of the persons from the isolation facility will be released today. Now, out of the remaining 12 cases from this number of 29, there are 8 Barbadians and 4 non-nationals, 8 Barbadians, 4 non-nationals. We also have another 49 results that are pending today.
Manager of Isolation Facilities and Infection Prevention expert Dr. Corey Ford also shared good news from the isolation facilities around the island. He reported that several patients are improving.
In that area, we have 3 individuals who are currently on oxygen. Remember, the last time I spoke to, we had way more than that. So we had some improvement. We had some discharges. And one of them still remains that Barbadian male of interest, which I talked before. He's still in a moderate to severe state in terms of his disease. Additionally to that, to the facility, we added one more interesting case I'd like to let you know about. And this is a Trinidadian national who has kidney disease. And she has had a transplantation of a kidney in the past, or early last year, and is presented to us with COVID. So we're watching her quite carefully. And of course, in that facility, we have the capacity to do dialysis. And this is one of the things we've been discussing, certainly with nephrologists on site. In our facility at the primary isolation area of interest as well is one pregnant female, about 33 weeks pregnant. She's actually quite well, and we actually admitted her there to that area really as a real precaution more than anything else, and she's being followed by the obstetricians and has been from the beginning. Additionally, in our other facilities, in our Blackman Gauntlet facility, we had one transfer back to the Harsons Point facility, a middle-aged guy, Barbadian, who felt unwell, and we just took the precaution of transporting there. I will say that he's currently stable. At our prison facility, I have some good news for you this evening. If all things, knock on wood, turn out like the way we want them to, we should have up to about 73 discharges tomorrow from our prison population, and that really, for me, would be great.
In other news this Thursday, a day after the Democratic Labour Party lost Simon Alleyne, it has gained a new member from the opposition People's Party for Democracy and Development. Word of this from President Verla de Pisa, who says the party remains focused.
For the Democratic Labour Party, any loss is an event. We will not call it a significant event, but any loss is an event. However, we balance that because we have had persons coming over to us from the Barbados Labour Party. We've had persons coming over to us from the PDP. Just this week, as we were having our council meetings, we had Paul Gibson, formerly of the PDP, join us. We have had prominent members of the Barbados Labour Party join us. The difference is that we don't feel the need to make a spectacle of people. One, you open them to more scrutiny than they probably want to have. And two, we prefer to work. And we will work with who wishes to work. Specifically in relation to Simon Alleyne, I believe it is out there that his disappointment at not being named the candidate in a particular constituency, he didn't hold it back. I believe at the time he made a statement, I will say in his favor, that he did not blindside the party. He had conversations, but disappointment happens in politics.
There's regional and international news after this short break.
Barbados Today, news you can trust.
To regional news, CARICOM is making a strong case for equal and fair distribution of the COVID-19 vaccine when it arrives in the region, and is calling on member states to jointly speak out on the issue. More in this report from Television Jamaica.
Following a statement issued on Wednesday, CARICOM said it was deeply concerned at the current prospect of inequitable access to vaccines, especially for frontline workers and the vulnerable population. Epidemiologist Professor Peter Figueroa is calling on countries within the region to speak out on the issue.
So it's always good when lesser developed or low income and middle income countries speak out on these issues. Now, to change the actual reality is going to require a lot of hard work and advocacy.
CARICOM says given the transmissibility of the virus, all countries are vulnerable and should work together. It's why Professor Figueroa is supporting the call for frontline workers to be considered a top priority.
Let us ensure that all countries have some of the early limited supply of vaccine to give to their frontline health workers so that all health services in every country globally can sustain its health services for their people.
A team of experts from the World Health Organization arrived in Wuhan today to start a probe into the origins of the coronavirus, as China reported its first death from COVID-19 in 8 months.
China has promised full cooperation and openness to the WHO ahead of this mission, and the WHO investigators currently in China intend on discussing this pandemic with their Chinese counterparts in the Chinese scientific community. They also want to see, while they're here, if there's any unexamined samples of previously unexplained respiratory diseases that can still be found, and they obviously want to better understand the ways in which the virus could have jumped over the species barrier to human beings. So the question here is, are they actually going to be able to do this? I mean, China has a history of pressuring people into repeating and saying the party line. This is something, as a journalist in China, that you see often. It's rare to hear dissenting voices out in public. And then there's a question of how likely it is that they'll find anything a year after the initial outbreak. If we take the example of Huanan seafood market, which is considered to be the epicenter of the pandemic, well, it was closed, completely closed over a year ago, and has been entirely disinfected as well. The WHO team is here at China's invitation, and they know very well that China is pushing forward that this is a sensitive topic in China, and that China is pushing forward this idea that the virus didn't originate within China, that this is only the place where it was first detected. So that's why the WHO team has been at pains to explain that this is not going to be a finger-pointing exercise directed at China. This is just a mission to better understand the virus.
That's news, but for the very latest, visit our website at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media and bus terminals, as well as screenplay at supermarkets and gas stations near you. You can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.